Hello, my name is Jeff Good, Technology Specialist with Webster Veterinary. This DVD is brought to you by Webster Veterinary as a way to introduce digital intraoral radiographs into your practice. You've purchased a digital sensor similar to one of these. The sensor is plugged into a USB interface. The interface then is plugged into either a laptop or a desktop computer. The techniques being demonstrated today can be obtained either using a conventional or handheld dental X-ray generator. At this time, I'd like to hand it over to Dr. Stephen Jariga, board-certified veterinary dentist.
Before we begin, I'd like to go over a few common terms we'll use today in our positioning. The oral cavity is divided into 4 quadrants. The teeth and structures of the upper arcade reside in the left and right maxilla. The teeth and structures of the lower jaw reside in the left and right mandible, which is joined rostrally by the mandibular symphysis. The terms rostral and caudal are used to describe structures of the head and skull, with rostral being towards the nose and caudal being towards the rear. When discussing the teeth, the terms mesial and distal are more appropriate, mesial referring towards the midline, whereas distal refers away from the midline. The term lingual is a term used to describe the tooth surface closest to the tongue, while the term palatal is a term used to describe the tooth surface closest to the palate. Buccal is a term used to describe the tooth surface closest to the cheek. The final terms, coronal being towards the crown and apical towards the root, are commonly used in veterinary dentistry. When learning dental radiography techniques, consistency is important. Therefore, to reduce the variables, we like to start with all of our maxillary images with animals in sternal recumbency. For images of the rostral mandible, we prefer to place the animal in dorsal recumbency with a rolled towel placed underneath its neck to position the mandible in a parallel position with the table. When taking images of the premolars and molars of the mandible, we prefer to have the animal in a lateral recumbency with the head propped off the table. As one masters positioning, images of both the maxilla and the mandible can be taken in lateral recumbency. The procedures that we're going to be demonstrating today will be on natural bone skulls. It's very important to practice procedures on these skulls before moving on to the clinical patient. The following procedures that we'll demonstrate today will apply to both the canine and the feline patient. When taking images of the premolars and molars of the mandible, we want to use parallel technique. Parallel technique requires that the sensor is placed parallel to the cone end. To achieve this, we place a sensor between the tongue and the mandibular teeth and move the cone end into a parallel position. In order to achieve an image of the maxillary incisors, we insert the sensor in this position in the oral cavity. The plane of the incisors is this plane, so therefore the bisecting angle is in this plane, and the tube head is moved parallel to that position. In order to obtain images of the maxillary canine teeth, it is important to learn the oblique imaging view. Oblique imaging is necessary because the maxillary canine teeth are superimposed over the first, second, and third premolar in the rostral maxillary view we took earlier with the incisor teeth. The sensor is placed in the mouth, slightly distally, so that it is going to be superimposed over the root structure. The cone head is moved into a position such as this, in a bisecting angle, and that it is rotated 30 degrees to the right to attain an image of the right canine tooth, or 30 degrees to the left to attain an image of the left canine tooth. This will result in cone cutting, where the crown of the tooth will not be visible, but the complete root will be visible due to the size of the sensor when you take this view. Based on the clinical importance of disease of the fourth premolar, first molar, and second molar of the maxilla, as well as fractures of the fourth premolar, this image is taken quite commonly, but can be quite challenging. The sensor is placed in the oral cavity in this orientation. The plane of the teeth is in this orientation. The plane of the sensor is in this orientation, so therefore our bisecting angle is like this. The cone head is positioned into a bisecting angle centered over the fourth premolar, actually centered between the distal root of the fourth premolar and the first molar, in order to achieve a good image of the distal root of the fourth premolar and the neighboring teeth. In order to image the triple-rooted teeth of the maxilla, primarily the fourth premolar, although the first molar and second molar are triple-rooted teeth, it's important to learn the tube shift technique. The tube shift technique is primarily used to separate the mesial roots of the fourth premolar, which are superimposed over one another. The sensor is placed in the oral cavity in this position. Again, the sensor is placed in this plane. The plane of the long axis of the teeth is in this plane, and therefore the bisecting angle technique is in this plane. The tube is placed into a bisecting angle technique centered over the fourth premolar, and then is moved obliquely 10 to 20 degrees cranially, or may be placed in a bisecting angle technique and moved 10 to 20 degrees caudally in order to separate the roots and get an image that can diagnose pathology on these roots. In order to image the incisors of the rostral mandible, the sensor is placed into the oral cavity in this plane. The plane of the incisors is this plane. Therefore, the bisecting angle is located here, and the tube head is moved into position to attain this image. When taking an image of the canine teeth, it is necessary to move the sensor caudally into the mouth so that an apical view of that tooth can be attained by moving the tube head into this position. The mandibular symphysis prevents parallel placement of the sensor in the rostral mandible to image the first, second, and third premolar. So therefore, the sensor is placed into the oral cavity in this plane. The plane of the teeth is in this plane. The bisecting angle, therefore, is in this plane, and the tube head is moved to achieve the image. The techniques that were just discussed apply to both the feline and the canine patient. The techniques that we're going to present next will prevent superimposition of the zygomatic arch in the feline patient so the premolars and molars can be adequately visualized. Imaging of the feline maxillary, premolars, and molars is challenging due to the large zygomatic arches that are typically superimposed over the roots of these teeth. The sensor is placed into the oral cavity in this plane. The plane of the teeth is this plane. Therefore, the resulting bisecting angle is this plane, and the cone head is moved into the bisecting angle positioning. In order to prevent superimposition of those roots in the zygomatic arch, the cone head is rotated downward in order to elongate those teeth slightly and get an acceptable image. In order to properly image the premolars and molars of the maxilla in feline patients, it's important to learn the extraoral near parallel technique. In fact, that's a preferred technique by most clinicians to avoid superimposition of the zygomatic arch over the roots of these premolars and molars. In this technique, the sensor is placed extraorally underneath the patient's head. The crowns of the teeth are aligned at the tip of the sensor so that the roots may be projected to the center of the sensor. The X-ray beam is placed in a parallel, then moved into a near parallel positioning to create this image. Again, with the cone is moved into a parallel position and then moved into a near parallel position for the resultant image. Using this model with artificial gums, and if you can imagine lips, is a good time for us to discuss the two most common positioning errors we find in veterinary dentistry. If we use the cone to achieve bisecting angle technique, the image of the incisors will be appropriate. If the cone was placed too horizontal, the resulting image will result in elongation of the roots or roots that are too long. Conversely, if the cone was placed in too horizontal of a position, the resulting image will have foreshortened roots or too short of roots.
We would like to thank you for your time. We hope you find this information useful. For more information, please contact your Webster representative, or for additional resources, please refer to the computer files on this disc. Thank you.